Common diseases and control. Cattle are subject to a large number of diseases. Cattle in normal health appear bright, alert, and active in their movements with a shiny coat. They also enjoy normal appetite and sleep. Cattle in health appear dull, restless, and posture frequently with a drop in milk yield. Contagious diseases. The diseases which spread easily by various modes are contagious diseases. These diseases are of bacterial or viral origin. The bacterial diseases are anthrax, hemorrhagic, septicemia, mastitis, and tuberculosis. The viral diseases are cowpox, foot and mouth diseases, and rinderpest. Number one, anthrax. Anthrax, a bacterial disease as due to beta anthracis, which causes sudden death in cattle. Symptoms: high temperature, 41.5 degrees centigrade, swelling of the neck, throat, flanks, and lumbar regions, which are neither hot nor painful. Blood discharges from natural openings. The affected animal dies in 10 to 36 hours. Control: vaccination with spore vaccine at the age of 6 months and then annually. Affected animals are to be segregated, contaminated flesh to be disinfected, and carcasses to be buried deep. Cowpox. Cowpox is a contagious viral disease attacking cows and buffaloes and also humans. Symptoms: retarded rumination, swelling of udder and tits, rise in temperature, eruptions on skin and udder and tits, developing into vesicles, pustules, and scabs by stages, ultimately leading to mastitis and loss of milk. Prevention: segregation of affected animals, giving sloppy food for swallowing and digestion. Fermenting udder with warm disinfectant solution, giving saline laxative and diuretics, treating lesions with mild antiseptic ointment. Cow shed should be kept clean. External parasitic diseases. Common ectoparasites are flies, ticks, mites, fleas, and lice. They are directly involved by sucking the blood from cattle and become an irritant. They are also indirectly involved in transmitting bacterial, viral, and protozoan diseases. Internal parasitic diseases. Hookworm, roundworm, tapeworm, and flukes are some of the intestinal parasites causing diarrhea, dysentery, and some other complications. Non-contagious diseases. The diseases which does not spread by external modes but are caused by physiological or genetical means as known as non-contagious diseases. Milk fever. Milk fever is common in high milk producing cows and buffaloes during the early part of the lactation. It is due to inability of the animal to assimilate calcium from the feed, leading to demineralization in the bone. The serum Ca and P levels become low and sugar level gets increased. Symptoms: staggering loss of appetite, temperature becoming below normal, pulse rate becoming high, restlessness and become inactive. Precaution and first aid. Feeding jaggery along with lime water few days prior to calving and giving soft, nutritious and easily digestible food for a few days after calving prevents milk fever. Cleaning the udder with warm cloth and preventing infection from the floor, pumping clean air into the udder, and messaging are other measures to be adopted. Constipation. Constipation is severe due to overeating, of course. Fibrous Rugages, inadequate intake of water, and lack of exercise, what leads to that of appetite, lack of rumination, achieving, and dull appearance. precaution and first aid. The affected animal can be given wheat bran meal or rice, gruel, and succulent fodder, plenty of drinking water with jaggery or salt. Evacuating the rectum by giving warm soap, water, enema, and massaging the abdomen are the other measure of treatment. Techniques adapted in cattle breeding. Outbreeding. Outbreeding is mating of less closely related or unrelated animals. The individuals involved do not have common ancestors in the preceding 4 to 6 generations. Crossbreeding. Crossbreeding as mating of animals different breeds, it is valuable as a means of introducing desirable characters into new breed in which they have not existed formerly. The crossbreed exhibit increased growth and vigor by the blend of desirable dominant genes from two breeds. In the first generation, artificial insemination. Artificial insemination is the deposition of male reproductive cells, spermatozoa, in the female reproductive tract by mechanical means rather than by natural mating. Semen is collected from the male by artificial means. Semen is inseminated into the female by placing a portion of it either a collected or in a diluted of the uterus by mechanical method at the proper time and under most hygienic conditions. It helps to eliminate the needs for maintenance of heart health, long distance transport of semen by air, avoid spreading of genital diseases, and increases the rate of conception. Further, this method helps better recording, permits use of semen from injured and old bulls, and provides a chance of detecting any genital abnormalities or pathological infection, inflammation in cows. Poultry. The term poultry refers to rearing and breeding of avian species such as chickens, ducks, turkeys, geese, and Ganya fowls, which have been domesticated. They are the best converters of feed into animal protein compared to other livestock. Chickens are the most common poultry enterprises. Chickens alone occupy 90% of the total poultry breeds. There are more than 100 breeds and more varieties of fowls. The fowls are classified based on their utility to man. They are mate type, egg type, dual type, and gams are ornamental type. Based on their origin, there are four major exotic breeds of fowls. They are American breeds, Asiatic breeds, English breeds, and Mediterranean breeds. In addition to the above, many of the indigenous breeds are also reared.